Hello, I'm Gabby. I'm your nurse today. Can you go ahead and give me your name and date of birth?
Kayla Hoslog, 72597.
Okay, perfect. Thank you, Kayla. So I'm just going to have a seat here. We're just going to do a little health history screening for you. And, what brings you in today?
I've been having headaches more often than I used to, so.
More often? Okay, I'm going to jot some notes down if that's okay.
All right.
Okay. And how long has this headache lasted this time?
I mean, it's on and off, but it's kind of every day here lately.
Every day?
Yeah.
Okay. And how often do they usually occur?
Probably, kind of like, well, if I take ibuprofen, it's usually kind of like every 5 hours, every 6 hours, something like that.
Okay. 5 to 6 hours?
Yeah.
Okay. And you just said that you take ibuprofen. Do you take any other medications?
I take Advil too.
You take Advil?
Yeah.
And how often do you rotate those usually?
I usually take like ibuprofen and then I'll take Advil the next time, so.
Okay, so you do rotate evenly?
Yeah.
Okay, awesome. Well, thank you for that. Write that down here. Okay. And do you have any allergies to either food or medications?
Augmentin, I do.
Augmentin? Okay.
Yes.
And what about any medical history for you?
I mean, not really. I have a little bit of hypertension going on.
Okay. And is that new with the headache?
Yeah. And it doesn't help that nursing school kind of stresses me out. So.
Okay. That's understandable. Do you have any lung issues or heart issues?
No.
Okay. And no diabetes?
No.
Okay. Awesome. And your vaccines?
Are
they up to date?
Yeah.
Perfect. Do you have any family history of headaches?
Not of headaches.
Okay.
My mom's dad, he had heart disease, and then he was a type 2 diabetic, and then my dad's mom passed away from lung cancer.
So. Lung cancer? Okay. But that's all you have for the family history?
Yeah.
Okay. All right. And for your personal life, are you married or single?
I'm single.
Okay. And do you have any kids?
I have one little boy.
One little boy? Oh,
yeah.
How old is he?
He's 11 months.
Oh, that's cute. Perfect. And do you use any illicit drugs?
No.
Okay. Any alcohol intake?
I mean, yeah, nursing school makes me drink, so.
Okay. And how often would you say you
it's drink? Like once a week, maybe.
Oh, okay.
That.
So not too often?
No.
Okay. You don't have, do you have a lot of drinks when you drink? Or
no, it's one and that's fine.
One and done?
Yeah,
okay.
One and done.
All right. All right, so I'm just going to go ahead and do a little assessment, your head to toe assessment here. So I'm just noting that your skin is warm and intact, and there's no lesions or rashes anywhere, right? No wounds?
Nope.
Okay, awesome. And have you had any visual changes with your headache?
I get a little like my eyes get a little bit of blurriness to them, but that's it. Other than that, I'm fine.
Do you have any sensitivities to light?
Yes.
You do have any sound sensitivities?
Not sound, light is definite.
Light? Okay.
Yeah.
And then also, have you noticed any ear drainage, nose, or eye drainage?
Nope.
Okay. And have you had any neck problems? Any pain in your neck?
A little bit. It gets a little bit stiff when I do get my headaches, but other than that, no.
Okay. Not usually.
No.
Okay. Awesome. And for your respiratory system, do you have any shortness of breath or cough?
Nope.
Not happening? Okay. Do you have any heart irregularities? Heartbeat? Nope. That's good. All right. And do you have any stomach pain?
No.
Okay. Do you have a normal bowel pattern?
Yeah, usually like every 2 days. So.
Okay, that's normal. Yep. And how's your urinary? Is that normal? You drinking a lot of fluids?
Trying
to. Okay.
Mm-hmm.
But you don't have like a urge to
No.
urinate?
No.
Nothing like that? Okay, awesome. And have you noticed any color changes to your skin or temperature changes?
Nope.
Nothing like that? Okay, good. And how often do you exercise?
With quarantine going on, I don't exercise near as much, but I usually try to exercise at least 3 times a week.
Okay, that's good. That's healthy. And do you do like cardio as a strength?
It's kind of like a cardio, endurance, weightlifting all in one because it's a lot like CrossFit stuff.
Okay. Okay. Yep. That's good then. Do you overall feel happy with life?
Yeah.
Fulfilled? Good. Like that. Okay. And have you had any recent falls?
No.
No head injuries recently or loss of consciousness?
No.
None of that? Okay, good. Well, that's very good. And do you have any bleeding problems? Are you on any anticoagulants?
No.
Nothing like that? Okay. And you said you do not have diabetes, right?
Nope.
All right, well, I'm going to go ahead and just report this off to the doctor. Do you have any further questions for me?
No, ma'am.
All right, well, thank you, Kayla. We'll get you checked out, okay?
All right.